Hello, I'm Professor Gordon Slater, and today we're cutting through the hype around peptides. Peptides, you've probably heard about them. They're one of the biggest talking points in sports medicine right now. There's a lot of buzz around them, with some people claiming they could completely change how we recover from injuries. But how much of that is real and how much is just hype? That's exactly what we're going to explore. Right now, there are basically two camps. On one side, you have people who are all in, saying peptides are the future of healing, a real game changer. On the other side, there's a lot more skepticism, with people who think it's mostly excitement without enough solid proof behind it. And that leads to the most important question of all. If you cut through the noise, what does the evidence actually show? Before we go any further, let's get on the same page. What even are peptides? The simplest way to think about them is as tiny protein building blocks. Their main job is to act like messengers, moving around the body and carrying signals that help cells communicate with each other. That communication can influence healing, inflammation, and tissue repair, which is exactly why so many people are interested in them. To make sense of the topic, it helps to think about the evidence in two broad groups. First, there are peptides that look promising in lab research and animal studies, but are still not well proven in humans. First up is BPC-157. This is probably one of the most talked about peptides out there. It seems to have real potential for healing tendons, ligaments, and muscles. It's derived from gastric juice, in other words, from the stomach. And in animal studies, the results have looked quite dramatic, with faster healing and reduced inflammation. There are also some early encouraging human reports. But, and this is important, we still do not have large, high-quality, randomized controlled trials in people. That means the promise is there, but the proof is still limited. Next is TB500. This peptide has been linked to important healing processes, including tissue repair and the growth of new blood vessels. Again, the lab and animal research is interesting, but just like BPC-157, strong human evidence for specific orthopedic outcomes is still missing. A lot of the support for it right now remains anecdotal. Then there's GHK-Cu, also known as copper peptide. This one is a little different. It already has solid evidence in skin and wound healing. Researchers are now looking at whether those same benefits might also apply to tendons, cartilage, and joints. That makes it an interesting area of research. But for sports medicine, the evidence is still emerging, and we need more joint-specific human studies before making strong conclusions. Now let's move up the evidence ladder. This brings us to a second group of peptides, the ones with somewhat stronger human data. A combination you hear about a lot is CJC-1295 and Ipamorelin. These work a bit differently. They help the body increase its own growth hormone signaling. There is supportive human data showing they can do that reliably, which may help with recovery, muscle repair, and even sleep. But we still need to be precise about what that actually means. While the data suggests they can affect hormone levels and support recovery, we still need better studies looking at clear orthopedic outcomes, such as tendon healing or cartilage repair after injury. And that brings us to collagen peptides. This is where the strongest human evidence sits. Out of all the peptides discussed here, collagen peptides have the best clinical support. Multiple randomized controlled trials suggest they can help reduce joint pain and improve function, especially in people with osteoarthritis. They also stand out for practical reasons. They're widely available, easy to take, and generally have a strong safety profile. That makes them the most accessible and evidence-backed option in this whole conversation. So, after all that, what's the big picture? The evidence really does look like a ladder. At the lower end, you have peptides like BPC-157 and TB500, where most of the excitement comes from animal and lab studies. A step above that, you have CJC-1295 and Ipamorelin, which have some supportive human data. And right at the top, with the strongest human trials, you have collagen peptides. Before we wrap up, there are three really important warnings to keep in mind. First, apart from standard collagen supplements, these peptides are not approved for routine orthopedic use by bodies like the FDA or TGA. Second, because this is often an unregulated market, product quality and purity can vary significantly. And third, many of these compounds are banned by the World Anti-Doping Agency in professional sport. So what's the bottom line? Peptides are a genuinely exciting frontier in medicine, But right now, the hype is still moving faster than the hard evidence, and that leads to the most important takeaway of all. In medicine, good decisions should be led by evidence, not excitement. Thanks for watching, and I hope you found this helpful. Goodbye for now.